Your work as a caregiver is physically and emotionally demanding because you have to give so much of yourself to the patients that you care for. Hi, I'm Kathy Getrist, and today's topic of discussion is about caregiver stress. A recent study was done which asked caregivers what motivated them to become caregivers in a healthcare setting. Probably no surprise to many of you, the number one reason was the satisfaction that was experienced from caring for others. Even though that is a very important reason why we go into caregiving responsibilities, it doesn't mean that it's without stress. Stress is mental and physical tension and strain. The stresses that most caregivers report are the coping with residents' death. Think about if you were working in a long-term care facility and you'd cared for the same individual for a year, maybe 2 years, gotten to know their family, maybe their spouse, and they die. It's as though a member of your own family has died in that situation, and it's very sad and is very stressful for caregivers. Another is communication problems. Communication problems are not only with those that you work on the unit with, but it's folks in other departments. It's communication with family and patients as well. Conflict with family members can also be a source of stress. Sometimes family members seem to be very difficult to work with and are asking what seem to be unreasonable requests of you. Another source of stress is dealing with demanding patients. When we are in pain, sick, or are uncertain about what our future might bring, it does not bring out the best in us usually. It's a time when we are focused on ourselves, can be irritable, and that is a source of stress for caregivers. Working with others is stressful. You know what it's like to live with others, and the stresses that is in each of our homes. So too is working with others a source of stress. Balancing work and home is also stressful. Each of those places wants more than half of us, and it's a balancing act to try to meet both expectations. Sometimes there might be a sick child and it's difficult to come to work. Sometimes you're asked to work overtime or an extra day, and you have demands at home. So balancing that is a very stressful experience. Before you can learn some techniques to cope with the stresses that you and that we all experience, it's helpful for you to recognize stress when you're experiencing it. First of all, know that stress is normal. Stress is something that all of us experience multiple times in the course of any given day. There are two types of stress. One is a positive stress called eustress. Eustress can be motivating. Take the example if you had an exam coming up tomorrow. It's very motivating. The stress that you experience today can be very motivating to be sure that you study and can do well on that exam. Also can be exhilarating. Positive stress such as preparing for a wedding or the birth of a child, even though very stressful, is an exhilarating experience. Also, positive stress can take the form in an emergency situation. Think about if a child darted out in front of you and you're driving a car. The ability to be able to slam on your brakes, to be able to stop in time to keep from hurting that child is a positive stress. That's called, what we all have within us, the fight or flight mechanism. When that happens, an emergency situation happens, our eyes dilate, we become more focused on the event, our heart rate accelerates, our muscles tense, and other physiological changes occur and allow us to be able to act fast in an emergency situation. Distress is negative stress. It's chronic stress that it takes physical and psychological toll on individuals. Chronic stress can be due to procrastination, can be due to relationship problems with others, and all sorts of other things, and need to be resolved as it will cause many physical and psychological health issues in the future. There's some general signs of stress. First, difficulty relaxing or slowing down. That means the individual might be fidgety, they might be tapping their pencil, tapping their foot, gritting their teeth, certainly a sign of stress. Overreacting to small events or problems, being short-tempered, seeming to make a big deal out of what you might term to be not that big a deal at all. Having trouble sleeping or waking up in the middle of the night and not being able to get back to sleep, another sign of stress. Increased use of alcohol or other recreational drugs in an effort to relax. Weight loss or gain. Some people under chronic stress will eat everything in sight. Others won't eat anything at all or have a very difficult time eating. I'm one of those latter people. When I'm under a great deal of stress, the last thing I want to do is to eat something. Feeling very weak, exhausted, tired, maybe not taking care of your personal hygiene, other signs of stress. Having a short attention span or not seeming to pay attention to what's going on at hand. A feeling of being preoccupied with the stress that is being experienced. Having trouble getting out of bed in the morning and carrying on with the day's activities, whether they be going to work or doing what needs to be done at home. Multiple complaints of physical aches and pains, another source of stress. And you could add to that list many others, I'm sure. Chronic stress takes its toll on us physically and emotionally. Hypertension, which as you remember is high blood pressure, is one of the problems of chronic stress. Stomach problems such as ulcers, gastritis, acid stomach, depression and anger. Decreased immune system, which prevents us from being able to ward off infections, is another cause of chronic stress that has its effects on health. And chronic headaches and backaches has been researched as a real problem with chronic stress. All of us try desperately to find ways to cope with stress. There are some healthy coping strategies and there are some faulty coping strategies. The first I'd like to focus on are the faulty coping strategies and should not be used. The first might be drinking lots of coffee or other caffeinated beverage, as opposed to drinking maybe just 1 cup. The use of a lot of soda. Soda is not a very healthy choice as far as a beverage is concerned. Lots of junk food. It could be chips, could be cookies, could be any other thing that might be in a fast food restaurant, for example. Candy, popping candy, chocolates, whatever kind, ice creams, in an effort to try to soothe our stress. What about the things that you read? The media is full of stressful things. It might be gossipy kinds of things. It might be violence that you might see on television. Filling yourself with chronic media that is destructive to your emotional health is going to increase rather than decrease stress. How about Tums or other kinds of antacids to try to get rid of an acid stomach, using them